Hi everybody, this is Judy at Judy in the Kitchen. We're talking about reducing salt intake, and this video series would not be complete unless I covered the health risks associated with a high sodium diet. So like it or not, here's the sad information. Too much sodium in the diet can lead to a variety of serious health conditions, as if you weren't already familiar with that. Many people are personally familiar with that. To begin the list: hypertension, heart disease, and stroke. When we consume too much sodium, if it's from added salt at the table or cooking, restaurant foods, processed foods, wherever it comes from, the kidneys are forced to work very, very hard to keep the proper balance of fluids and electrolytes, sodium and potassium in the blood. They will retain water to dilute excess sodium in the blood, and that increases the amount of extracellular fluid, the volume of blood in the bloodstream, and that increased blood volume forces the heart to work harder and increases our blood pressure. Okay, over time, the extra work and pressure can lead to chronic high blood pressure, heart attack, even stroke, and eventually leading to heart failure. Kidney disease and kidney stones. Besides being a risk factor for heart disease and stroke and high blood pressure, high sodium is also a risk for kidney disease. As I made mention earlier, the kidneys have to work very hard to balance out the sodium level in the blood and keep it constant as much as possible. And when we ingest a lot of sodium, that puts a lot of heavy-duty work on the kidneys. With a prolonged high sodium intake and increased blood pressure from that, the kidneys can gradually lose their ability to excrete the excess sodium. A study reported in the October 2014 issue of the American Journal of Hypertension found that patients with chronic kidney disease who had intakes of sodium higher than 4,600 milligrams a day did experience progression of their disease. It goes hand in hand. A lot of scientific studies have found that there's a relationship between a high salt intake and increased calcium excretion through the kidneys. The amount of calcium that your body loses in the urine increases with the amount of salt that you eat. The blood level of calcium needs to remain very constant. So if we're eating a high salt diet and calcium is used to help excrete that extra sodium, then all of a sudden the blood level is low on calcium. That's not a good thing. So what does the body do? We draw from our reserves, which is the skeletal system, and we leach some calcium out of the bones and put it back into the blood to keep our blood level of calcium constant, because it's a mandatory thing. What does that do? It leads to bone issues down the road, but that extra calcium that it's also having to bring in all the time into the kidneys promotes kidney stones. Okay, so the kidneys take a real beating when we ingest a lot of sodium on a regular basis. Now back to the calcium, sodium, and bone loss. Again, the amount of calcium in the blood needs to be kept very stable. And when the kidneys are forced to draw calcium from the blood in order to help excrete that extra sodium, our body leaches calcium out of the bones in order to maintain the calcium level stable in the blood. What does this do? If it's on a chronic basis, it is going to rob the calcium from your bones and eventually lead to weakened bones, maybe osteopenia, and then eventually osteoporosis. This is not good. To maintain a normal level of calcium in the blood without weakening the bones, we should have between 1,000 and 1,500 milligrams of calcium a day. But when we eat a lot of salt, we can counteract things and make everything all awry. So bear that in mind. If you love the salt shaker or love your processed foods, you might be weakening your bones in a roundabout way. Stomach cancer is another potential issue with a high sodium diet. Now, people have been using salt as a means of preserving their food for thousands of years. In recent times, we've come up with technologies where we don't have to use so much salt for sure, but nevertheless, salt remains a common practice despite recommendations to reduce our salt and sodium intake. Stomach cancer or gastric cancer is found around the world, and dietary factors, including salt intake, are considered to be causative. Okay? In a 2014 issue of the journal Cancer Treatment and Research, researchers examined a number of published studies and found that salt intake, along with a stomach infection of Helicobacter pylori, which is a bacteria, does play a role in the development of stomach or gastric cancer. A comprehensive meta-analysis of long-term studies found a strong effect of total salt intake and salt-rich foods and the risk of gastric cancer in the general population. And researchers have evidence that supports the possibility of a substantial reduction in cancer with reduced salt intake. Bear in mind that the H. pylori or Helicobacter pylori bacteria infects the stomach. This infection can easily happen during childhood, and we usually have no idea that we're infected with H. pylori. But it is known to be a common cause of stomach ulcers. Okay? Researchers estimate that more than half the people in the world are infected with H. pylori. And people are usually not aware that they're infected with this bacteria until they start developing symptoms of a stomach ulcer. They might have an ache or a burning pain in the stomach, and stomach pain that gets worse when the stomach is empty. They might feel nausea, loss of appetite, frequent burping, bloating, and unexplained weight loss. In a study published in the May 14, 2009 issue of the World Journal of Gastroenterology, researchers reviewed the results from studies on the relationship between salt or salted food intake and stomach cancer risk. And they did find that there's an increased risk of stomach cancer with a high salt diet or high sodium diet combined with Helicobacter pylori infection. Since we don't know if we are infected with that bacteria or not, it's really best, for a lot of reasons, to keep your salt and sodium intake down as much as possible to avoid getting stomach cancer. And as a note on that, to lower your risk of developing stomach cancer, in addition to reducing your salt and salty food intake, eat more fresh fruits, especially citrus fruits and raw vegetables. Such foods appear to reduce the risk of stomach cancer. I do hope this helps you out. You know, this is not a list that we all want to hear. We want to hear what's great about eating a lot of salt. I can't offer that kind of information. There's nothing great other than the flavor that you enjoy about eating a lot of salt. I do hope this helps. Take care. Bye for now.